Chronic myeloid leukemia is a disease that is relatively rare, but really I think is a model of where oncology is hopefully heading.
You may not have heard of chronic myeloid leukemia, but what researchers have learned from it speaks volumes.
Chronic myeloid leukemia was a few years back, before these drugs were discovered, was basically uniformly lethal within 5 years. And nowadays it's really become a chronic disease, just like diabetes or hypertension.
People with this form of leukemia often have few outward signs other than a low-grade fever, frequent infections, bruising, even minor hip or joint pain. But a thorough examination would show an acquired genetic mutation.
There were two genes, or two chromosomes that are supposed to be separate. When somebody developed chronic myeloid leukemia, those two separate chromosomes, for some reason, came together and eventually replacing the normal bone marrow with all these abnormal cells.
85% of patients are diagnosed in the chronic phase. By the time treatment starts, their disease is accelerating. Now new tests and new drug inhibitors catch it early and increase survivability.
We've been able to diagnose it through simple blood tests. We can treat the disease with a pill a day. With the pill, you eliminate that fusion protein. And once you eliminate that, then the cells can work perfectly normal again.
It's lengthening the life of chronic myeloid leukemia patients and extending hope for cancer treatment.
You have changed the way you diagnose the disease, you have changed the way you treat the disease, and you have changed the outcome of the disease.
For Lee Memorial Health System, I'm Amy Osher.